Hi, this is Dr. Joe from Coastal Dental Group in Point Pleasant, New Jersey. With the recent COVID-19 restrictions lifted, we are now able to do all dental care, including cleanings, fillings, Invisalign, everything, even whitenings. With that in mind, please understand there are still certain limitations on what we can or can't do. There's still a certain amount of people allowed in the building at one time. There will be no double booking. Still hand sanitizing is still going to be necessary. Forehead temperatures. So please, if you look at the previous Facebook videos, you will see certain videos such as a routine dental check-in and the precautions that we are still taking to avoid any COVID-19 contaminations, okay? With that being said, it's very important because over the last 3 months, life kind of stopped. And what I want to do is get back to normalcy. One of the things being is just cleanings. Now, since I've been a dentist for 23 years, I hear continuously, it's just a cleaning. It's just a cleaning. It's not just a cleaning. If you look up here, I'm going to be posting this, so if you don't catch it, it's fine. There'll be a still picture of this beneath this video. First of all, I see a lot of issues where people have systemic problems such as diabetes or smoking. Those two things definitely impact the oral cavity. One of the things that smokers get is a decreased salivary production, and it results in more cavities. So that's important that we handle that. Also, smokers and diabetics are more susceptible to gum disease. Now, gum disease means two things. It means gingivitis, which means puffy, bleeding gums, or the bone beneath the gingiva also begins to recede. So these are problems that need to be checked. If you pay attention to the third one, it says computer-generated periodontal charting. In addition to checking the teeth, we always check the bone underneath. If you ever known anybody who has loose teeth, that is gum disease. So if you are a smoker or uncontrolled diabetic, the bone actually sees and the teeth loosen up. I've been pulling teeth since dental school, and I've pulled out thousands of periodontally involved teeth. They could either, the patient could come in and the tooth could actually be in their hand, or I literally get them numb and I could either pull it out with my fingers, or I might need a plier, as opposed to an impacted wisdom teeth where I have to use a drill to cut it out. So this is a real thing, and I see it every day, okay? Another thing is oral cancer screening. I do have a video on oral cancer screenings. Now, we have found 7 cases of head and neck cancer. Recently, right before the COVID pandemic hit, I thought I had my 8th case, and it looked exactly like oral cancer, but thank God I biopsied it and it came back negative, all right? I've been seeing a lot of TMJ, temporomandibular joint pain. Now, during this COVID, and I've seen a lot of it, people are grinding more than they should, and they're actually getting pain in their jaw joints. There's different things we do for that. One of the things is referral to a physical therapist. Again, this all falls under the premise of a cleaning. There's other things we do besides just clean your teeth. Now, very important, we will be cleaning your teeth. Gum disease comes back as soon as 90 days. So gum disease, like I said before, is either soft, red, inflamed gums, or bone loss around the teeth. If you clean your teeth, if your teeth get cleaned and then you don't clean them for a year, that's a problem because the gum disease comes back as soon as 3 months later. So again, your gums need to be checked, and then we need to actually clean them. Now you say, hey, I brush my teeth. I'm telling you, I'm a dentist for 23 years. I get my teeth cleaned every 3 months, even though I don't have gum disease. Even though insurance only pays every 6 months. However, what I do is I like to get them cleaned every 90 days. I also like to set the example, and I literally do. I actually block off time. I come in the morning, and tomorrow we'll clean my teeth. But again, let's get back to, it's not just a cleaning. So we have TMJ pain, we chart the gums, we look for oral cancer, which I have found. We also take x-rays. It's very important. I see what you see in the mirror. When you look in the mirror, I see white teeth. However, when we take x-rays, I get to see in between the teeth, and then you can see the decay. Sometimes I look at beautiful white teeth, I can take x-rays, and I can see all the decay in between the teeth. So that's why x-rays are important. People like to refuse them. I cannot force anybody to do anything. However, when you do refuse them, just please understand, you can have a cavity in there and it can turn into a root canal and you'll never know it. okay? It's not always by sight, you need the x-rays. We got fluoride treatment. Now, some people who have head and neck cancer or some older people, smokers, they need to get extra fluoride. Again, this is all covered in a standard cleaning. And also, what I've seen with the amount of medication that people are taking, everything from antidepressants to high blood pressure medications, they cause dry mouth. It's very serious. Just remember, the purpose of saliva is to bathe the teeth so you don't get cavities. If you don't have enough saliva, that's very bad. The food sticks to the teeth and causes decay instantaneously. All right? So with that being said, I just want you to understand, I hear it all the time, it's just a cleaning. It's not just a cleaning. It's very important. I find problems when they're very small. If things are let gone long enough, especially with this COVID intermission, I'm seeing toothaches that I've never seen before, meaning people that have had good teeth, they're letting them go. I understand they were afraid to come in with the COVID. However, from letting things go too long, now I'm seeing root canals and pulled teeth. It's the same principle. I'm gonna leave you with one last food for thought. A cavity never hurts. Root canals do. You can have a cavity in your mouth, you can see the black in your mouth and it doesn't hurt. The second it burrows down and hits nerve, at that point root canal therapy is necessary. Okay? So if I catch them small, it's very easily to drill them out and put a nice white filling in. So I hope everybody is well and they recovered well from this COVID pandemic. We're starting to return toward normalcy, which I'm very happy. But remember, we are now open for routine dental examinations such as cleanings. We'll be doing those. So with that being said, any questions, comments, concerns, please call the office and we can get you scheduled for that. Thank you for your time.